We're on your side tonight, continuing the conversation about a potential triple-demic. Health professionals have warned that this winter there is the potential for people to contract the flu, RSV, and COVID-19. Of course, we're still in the midst of the COVID-19 pandemic. Flu season has now begun, and doctors across the United States say they are seeing RSV patients earlier than normal. A lot to think about, and the concern about these three sicknesses certainly raises a lot of questions. Alex is back with us tonight. You took those questions about these three different sicknesses to a professional. What are they telling you?
Yeah, I talked to Patty Ollinger. She's from the Global Biorisk Advisory Council, and she took some time to talk with me about these three sicknesses. And one of the things that's so tricky is she mentioned, they've all got similar symptoms.
Sure.
The big one, of course, that a lot of folks are concerned about is those respiratory issues that some people might find themselves dealing with. One of my biggest questions whenever we're doing stories about sicknesses is, when do I need to seek professional medical help? And so that's one of the questions I wanted to ask her. If you want to take a listen, Jamie.
The professional advice when it comes to actually feeling symptoms and getting sick. When do you tell people to seek medical help and, not just sit home?
Oh, that's really good. It's one of those things that know yourself and, hopefully you've established with a physician or, your primary care physician. If you are in a at-risk group, don't wait. At least give your physician a call. And nowadays, a lot of them are on the electronic where you can send emails and you can call the office very quickly. And when you start having that temperature, going up, it's knowing and paying attention to how you're feeling. The upper respiratory, that could go very quickly if you're starting to have problems with, feeling in your chest and, just call the doctor. They will help you through that decision-making process.
Every parent has had that debate, right? Do I need to go to the doctor? Do I not need to go to the doctor at this point? I'm curious, what more does she say about why we're seeing these cases of RSV and the flu so early this year?
Right. I believe the doctor you had in that previous segment, specifically about RSV, kind of touched on this. But she said, folks aren't completely sure, but she thinks part of it has to do with the fact that during the pandemic, everyone was so diligent about the masks and the hand washing and just the good hygiene in general.
Sure.
And now it seems like some folks have definitely slacked off a bit. You don't see as many masks, and maybe people are letting their guard up when it even comes to just washing their hands, and obviously you're going to have germs spreading more.
I mean, think about it. During the pandemic, if you were fortunate enough to avoid the COVID-19, you didn't even have a head cold, for so long.
You were good to go.
Yeah, and that was obviously because of mask wearing, things like that. Did she have a thought on that?
Yes, I specifically asked, even if everybody else isn't wearing a mask, because I know that was one of the big pushes during the part of the pandemic, is if we all do it together, it helps. I said, even if you're just the only one that wants to put a mask on, is there still a benefit to that? And she said she thought yes, especially if it was one of those N95, KN95, the higher quality masks with the better filtration. She said you can't go wrong wearing one of those. There's no harm in wearing that.
And if you're sick, stay home. We mentioned that earlier as well as we try to get this back under control.
Yeah.
Alex, good stuff. All part of this week's Good Question podcast. Remember, new episodes drop every Wednesday morning. Scan the QR code on your screen to listen. You can also find it on Spotify or Apple Podcasts. WBTV's Good Question, produced in partnership with the Queen City Podcast Network. Go check that out right now. Right now, we're getting